Oh, thank you for the introduction, Julie. Hi, everyone. My name is Michelle Huang. I'm one of the nephrologists with UCLA Health. My office is in Torrance. Today, I'm going to talk about blood pressure and your health. So I don't, not sure how many people log into this webinar. I can see everyone's face. I wish I can see, you and then we can interact in person, but due to COVID, unfortunately, this is the only way that we can communicate with each other. But you can see my face. So if you have any questions, like Julie mentioned, either raise your hand or there is a Q&A session at the end of my presentation. So before I start, I want to go over a brief introduction about like basic physiology about blood pressure. So understanding blood pressure. So what is the blood pressure? We have human body have a pumping heart. Everyone knows it's located on your left side, and then pumps 24/7. It pumps anywhere between 60 beats per minute to 100 beats per minute, and the heart pumps the blood into what we call the arteries. Here, the arteries, that this is the big artery, and then it goes to smaller arterioles and then becomes a little capillaries. So the heart pumps the blood everywhere to the every organ in our body, brain, lungs, kidneys, hands, or like GI system, any parts in our body. So it when it pumps the blood, it exerts a blood pressure. The pressure to exert to the artery, and then blood pressure is the pressure that it when it heart pumps to the exerts to the this wall of the arteries. So there are many factors that influence blood pressure. The main one is what we call cardiac output, that how powerful your heart pumps. And then also it depends on peripheral vascular resistance, which means that how smooth your vessels are. Obviously, if you have running water, if there is a lot of resistance, like either there is a bumps there, or the plaques, cholesterol, or there's a blood clot here, obviously it lowers the flow and increase the blood pressure. And also depends how much volume that you have in your circulating blood. If you lose blood for whatever reason, your blood pressure might drop because you don't have enough blood to pump throughout the body. Also, viscosity of the blood. Some people have a little thick blood and some people have a little thin blood. We'll get into that in detail in the next few slides. And also elasticity. Blood vessel is a muscular, so there is a muscle wall here, and depends how flexible the blood vessels are. It also depends, it as we get a little older, the blood vessel stiffens, and then if you have a stiff blood vessel, your blood pressure tends to go up as well. So when you go to doctor's office or you check it, happen to check blood pressure at home with the blood pressure machine, it usually give you two numbers, higher number and a lower number. Some people call it as top number and a bottom number. So what does that mean? So the higher number is what we call an systolic blood pressure, and lower number we call it diastolic blood pressure. So systolic blood pressure is the blood pressure that when heart is maximal contraction state. So heart pumps like contraction and it releases. Contract, when it contraction, it flows of blood everywhere, and that's when the blood pressure is the highest. So systolic blood pressure is the higher number. It indicates how much pressure your blood is exerting to the arterial walls when it's maximal contraction. And once it's contract, it relaxes as well. That's when the blood fills out back to the heart. That's the diastolic blood pressure. That's when your heart is relaxed state, and indicates it's usually the heartbeat. Heart is pump and then relax, pump and relax, and then that's the relaxing the state. That's the diastolic blood pressure. This is the lower number. So for example, you get, your when you go to doctor's office, they'll tell you, oh, Mr. or Mrs. So-and-so, your blood pressure today is 120 over 80. So 120 is what we call a systolic blood pressure, and 80 is the diastolic blood pressure. So I'm sure many of you already heard on the news, magazines, or in the doctor's office the blood pressure guideline has changed significantly past few years. So we can see in the American Heart Association recategorize what high blood pressure is and what normal blood pressure is. Used to, the high normal blood pressure is anywhere the higher number less than 140. And but a few years ago, American Heart Association recategorized as normal blood pressure is higher, the upper number is less than 120, and the lower number is less than 80. And we call it elevated, or some people call it pre-hypertension, is anywhere between 120, the higher number, the systolic blood pressure, and the lower number less than 80. And we categorize the stage one, two, and then crisis range. The reason we categorize in, you can see it's orange and yellow, and it's very blood yellow, oh, the red, sorry. So the healthcare providers, or patients can monitor, it depends on what stage blood pressure, hypertension that you have, the how often that we monitor, and then how often we check your blood test is different. So the stage one high blood pressure, hypertension, is anywhere between 130 to 139, the systolic blood pressure, or diastolic 80 to 89. And stage two is 140 or higher, and then diastolic 90 or higher. And when we call it hypertensive crisis is when higher number is persistently more than 180, and then diastolic lower than higher than 120. If your blood pressure is persistently, it's more than, you check it more than twice. And then if your blood pressure is persistently 180, you need to get medical attention immediately. So why do we, pay so much attention to blood pressure, and what does it, what kind of consequences it has to our body? A lot of people refer hypertension, high blood pressure, is a silent killer to our body. The reason is that you don't have any symptoms. So most people don't know that they have a high blood pressure. It estimate about 1 in 3 Americans have high blood pressure, especially after this recategorization of the what hypertension is. And you have no symptoms, and many individuals don't know they have it, and the blood pressure raises up gradually over time. And if you have high blood pressure for a long time, it raises your risk of, it damages all over your body from head to toe. You can have high risk of stroke by aneurysm, or blood clot, or you have the bursting of the arteries, what we call the aneurysm. And also everywhere in our body have vessels. So everywhere has a vessels, it get affected by high blood pressure. In your vision, you can have vision losses, blindness, or you can have heart failure. Either you have congestive heart failure with the decrease the pumping function, or more of the unable to relax. You can have a different type of heart failure, or you can have a stroke or cardiac attack, a myocardial infarction, which is the heart attack, or a kidney disease. A lot of people not aware that high blood pressure can damage a kidney disease. The number one cause for kidney disease in the United States is diabetes, and number two is high blood pressure. It's that prevalent. So what kind of people are at risk to develop high blood pressure? There is a factors, what we call it modifiable factors, or non-modifiable factors. So the factors that you can really control is your family history. If you have parents or grandparents have high blood pressure, the likelihood that you develop high blood pressure in your lifetime is a little higher. And also gender, under age 64, men are more likely to get high blood pressure than women. And at age 65 and older, women are more likely to get high blood pressure. And also there are factors that you can control. I'll get into more detail. What you eat, and also alcohol consumption, excess alcohol consumption. And if you smoke, or someone else close to you and your family members smoke, and how active you are, and your weight. Those are the factors you can possibly control to prevent or even treat high blood pressure. So how do you know if you have high blood pressure? It seems fairly easy, but a lot of things can go wrong when you're checking your blood pressure at home. First, we have to, it says step one, relax. But before this, we need to have a good blood pressure monitor. Like here, there are so many blood pressure monitor machine out there in the market. Some of them you measure with your fingers, some of them measure with your wrist, some of them measure with your forearm. American Heart Association and other also American Society of Nephrology, the physicians recommend if you need to buy a blood pressure monitor cuff, we recommend the one that has forearm, this forearm blood pressure cuff, rather than wrist or fingers. Those are tend to not to be as reliable. And also, it's very important once you have a new blood pressure machine, always bring it to our office or your healthcare provider's office or even pharmacies. Make sure that the blood pressure that you measure the machine, it measures accurately. I've seen a machine that, there's a difference between even higher number, 10 to 20, to the clinic one, our hospital ones and clinic blood pressure. So always, get a machine. If you get a new machine, let your doctors know or your pharmacist know to check if your machine is actually measure correct blood pressure. So once you have a blood pressure, what do you do? So, we're living object and our blood pressure changes throughout the day. Depends if you are, drink a coffee, have alcohol, if you are very happy, very sad, or very mad, very depressed. All those emotions at different stages can affect your blood pressure. And that's not a best time to check your blood pressure. So we recommend you wait at least half an hour after smoking. We hope you don't know none of the audience smoke, but if you do, please quit. And or after eating or heavy exercising. So right after exercise, your blood pressure goes up high, and that's very normal. And so we don't want change your blood pressure medication or recommend you other lifestyle modifications based on the blood pressure that it's falsely high. And then find a quiet room, sit comfortably at the table, and then place a monitor near you. And then wrap the cuff, have the palm up like this, and then put it on if you're right-handed, but I recommend you put it on your left arm here. And the bottom of this cuff should be 1 inch above the elbow area. So don't put in the right at the elbow, just 1 inch above the elbow. And then your rest, make sure that your arm is the same level at your heart. It's the best way to check it. If you put your arm down, it's not going to measure your blood pressure accurately. So put it like this, arm, and then relax. And then you press the button. Most of patients have an automatic blood pressure, and then you check it, and then give you two numbers and also heart rate as well. And then have a piece of paper. You can download it a log, or you can put it on your notebook, your phone. Doesn't matter where how you record it. Write down all the numbers. Write down numbers, and then if you have any symptoms like headache, if you have any symptoms of dizziness, lightheadedness, or any symptoms, write it down how you feel at that moment. And then also put in a time of the day as well. We want to make sure that your blood pressure is stable throughout the day. Like I said, your blood pressure changes throughout the day, and then we want to monitor it in the morning, lunchtime, before dinner time, or before you go to sleep. And we want your blood pressure to be as stable as possible. So you check it in the same time, like different time of the day, and then we have a blood pressure log. So I'm gonna go back to this slide, and then the normal is less than 120, and then lower number less than 80. The elevated is 120 to 129, stage 1, 2, and then crisis. So write those numbers down and take it to your healthcare provider um, with the numbers. It's very helpful because when you go to your clinic or doctor's office, we only have one numbers, and that may not be the accurate number because when you're in the doctor's office, you're probably not most relaxed, or you're probably anxious to see doctors, or sometimes we call it white coat hypertension. Your blood pressure might be falsely high in the clinic, And so we won't know, or maybe your blood pressure high constantly. Well, there's no way to for us to know unless we have your blood pressure log from home. And so before I go to the next slide, so what do we do after you have, the blood pressure log? It depends what categories you're at. If you're normal, great, but we can still talk about what are the lifestyle modifications to change. So prevent you ever develop high blood pressure because blood pressure, like we discussed, as you get older, you have higher chance to get high blood pressure. So even if you're normal right now, you can still adjust, the lifestyle modifications that I'm gonna go over, so you will never develop high blood pressure. That's the best scenario. So what do you have? How about you have elevated high blood pressure, 120 to 129, or pre-hypertension? Then that's the very good best time to start adjust the lifestyle modifications and things that you can change in your life to treat so you can go back to the normal range before we go to the other stage. If you have a stage one, usually lifestyle modification enough is alone is not enough to treat your blood pressure. However, it's worth to try. And if you have a stage two, we recommend a lifestyle modification and also possibly a pharmaceutical like medications. If you have a crisis, you need to talk to your doctor immediately. So it depends what category you are. So it's very, very important to keep the log and then bring it to your healthcare providers. So what are the some changes, the lifestyle modifications that you can adjust from today after this talk to, to have healthier life and then to not ever develop high blood pressure? Number one, if there's one message I want you to take from after this talk is salt. Number one is the salt. So select a low salt, low fat food. Salt limit for everyone is probably around 2000. I usually say 2000, but 2400 is the limit that American Heart Association recommended for 2400. So every time you eat anything, you have soup, you have a bag of chips, or have go out in restaurant, or have any type of like a food, go look at the label on the back and then see how much sodium that it has. A lot of them has a serving size. So you have a bag of chip and they say you have, for instance, you have 300 milligrams of sodium. That probably, if you have the whole bag of chip, it probably have multiple serving size. So make sure that the number that you see is not the number for the whole bag. It's have a make sure that you pay attention to the serving sizes. And then when I'm in a clinic, when I talk to my patients, it's like Mr. or Mrs. So and so, you have to decrease your salt. And a lot of them will come say me, Doc, I don't put any salt on my food, and that they're correct. Most of them we don't put salt in our food, but all the salt is already embedded in the food. It's a hidden salt. Anything that salt is a preservative. So if you buy any canned food, dry food, like sandwich meat or fast food, packaged food, all those has high salt content. Number one is that it's preservative, so it doesn't go bad. And second is it tastes good. So if you order steak at a restaurant, people think, oh, this is a protein, so it's good for me. When they cook it, they put a lot of butter, a lot of salt, a lot of peppers so by the time they serve it to you, say, hey, this is your steak, it already has a lot of salt in it. I'm not, asking everyone to don't go out and then don't eat steak, but just balance it out. If you have that salty food, and make sure that rest of the meal of your day do not have a lot of salt. Grilled food at home is a very good, or boiled, steamed, or those preparation I recommend rather than fried or with a lot of salt. And then proportion control. 8 to 10 servings of fruit and vegetable a day is good for not just the blood pressure, also preventing diabetes, also preventing heart and preventing kidney disease. Is very good to have balanced food, fruit and vegetables, and choose lean meat rather than fat. And then fish, chicken rather than other red meat is preferred. And also pick whole grain pasta, white rice instead of brown rice instead of white rice, and the beans are really good. way of taking all the nutrients. And also good to have low fat or fat-free dairy products like yogurt, low salt yogurt. And then when you go to a restaurant, ask for a meal prepared with no added salt. Like if you go to McDonald's, let's say if you want a French fries, they already put a lot of salt in there. Make sure that, hey, can I have without salt? They even fried it fresh for you. So you get fresh fries and also no salt. Um, I'm sure a lot of people here heard about DASH diet. It's right here. It's just a well balanced food. You have a little bit of grains, a lot of vegetables, a little bit of dairy food, chocolate, dark chocolate, and a little bit of sweets, and a little bit of seeds and lean proteins. Those are like the diet that recommended by by a lot of different health organizations. Another thing is maintain a healthy weight. So everyone's healthy weight BMI is different. So I recommend you ask your healthcare provider how much calories that you should take. Um, as we get a little older, our metabolism goes down versus when you're teenagers, you eat everything you want and you never gain weight. But as you get older, 20s, 30s, 40s, if you eat similar amount of food that you used to eat, you will gain weight. So make sure that you check with your healthcare provider how much calories that you should intake a day. Also, if you exercise and get more muscle and lose a little bit of adipose tissue, will itself lower the blood pressure anywhere between 5 to 10 of millimeter mercuries. So that's a lot of blood pressure decrease. And limit snacks and sweets and get regular exercises. So what kind of exercises that you can do? There's a lot of exercise. I know it's COVID era. It's very limited. Usually I recommend swimming. Swimming is the best exercise in my opinion. It's a cardiac. It's also muscle exercise, and it does not have a lot of strain to joints. So swimming is number one exercise I recommend to all the patients. But right now, I think a lot of gyms are closed. So when it's open up, that's something that even walking in water, it's better because it doesn't have much gravity. And so it's easy for your joints. Right now, you can walking, I think jogging, walking is good to increase your heart rate. Um, just strolling is not really good. I mean, it's good rather than you just sit. However, if you're gonna walk around, I recommend you walk a little brisk walk so you increase your heart rate. So aerobic is a cardiac exercise. Biking is good. Dancing is good with your partners. Anything going upstairs is also very good exercise. But a lot of them have strain to your joints. But hopefully all the gyms will open up that you can explore other things. And little things you can do in daily life. When you go to grocery shopping, park a little further away. I know everyone would try to find a parking right next to the entrance, but try to find parking a little further away so you force yourself to walk to this. Every step matters. To walk to the grocery store. And walk you can bike instead of driving around here. There's a lot of good walking area around the beach. You can walk around rather than driving. And we recommend you be active at least 40 minutes, 35 to 40 minutes for minimum like 3 to 4 days a week. But if you haven't exercised for a long time, this might be a lot for you. So start with a small amount, 10 minutes walking, still counts, 10 minutes, 15 minutes, and you do once a week, twice a week. So gradual increase that help your health. Manage stress. Um, I think this, right now, no, you can really see your friends, see your family, you can go out, you can really enjoy. Our life is all very limited, but try to find the time and what you can do. If you have pet at home, play with a pet, walk your dogs, and exercises or meditate, listen to music, anything that you want to do, have a Zoom meeting, or like go to beach, just lay down there or read a book, anything that you can do to manage stress. Stress um, can develop a lot of other health issues, not just the high blood pressure. Also limit alcohol and quit smoking. So smoking is bad. Even one cigarette once a month is bad for your health. So I recommend you quit smoking if you do. And alcohol, a little bit of alcohol is okay, especially wine. There are kind of studies that a little glass of wine is actually helpful for cardiac health. Men should drink no more than 2 drinks a day, and a woman is a little less than 1 drink. This is just reference, so everyone's tolerance is a little different. So depends on individual's health. And just briefly, I want to talk about the over-the-counter medication. So over-the-counter medication, many people think, oh, it's over-the-counter. It doesn't. There's no side effects, and I can take as many I want. That's not really correct. Decongestants, like has medication called pseudoephedrine, as Sudafed. It constricts your blood pressure. That's how it constricts your nasal area. When you have congested nose, it want to constrict your arteries. That's why, so you can breathe better. But not only constrict your nose arteries, and constrict everywhere. So, take it with caution. Don't take it too much unless you have to. And pain medications like what we call NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, those medications can increase your blood pressure and can damage your kidneys. So I recommend you take Tylenol instead if you have aches or pains. Cold and flu medications, because those usually have pseudoephrines already in there. Like Dayquil, NyQuil has already pseudoephedrine, so make sure that you read the ingredients. There's some antacid and some stomach medications can have the ingredients that constrict the blood vessel as well. And herbal supplements, depends on what kind of herbal supplements you take, that can raise the blood pressure. So if any of those lifestyle changes are not enough, if you have a higher stage 1, 2, and crisis, usually the lifestyle modification alone cannot really lower the blood pressure to the normal range. So we recommend everyone needs a lifestyle modification, and then some people may need help with the medications, pharmacological medications, to lower the blood pressure. And depends how you do it. You might be go off of medication. You need a closer monitoring with your healthcare providers. But if you have questions about your medications, there are so many different medications out there. If you are concerned about side effects or any other issues, do not wait just wait, talk to your healthcare provider before stopping or changing the medications. Otherwise, we assume that you take all the medication that we prescribe to you, and if it's not controlled, we might increase or even add a medication. So please tell us if you are not taking it. Please tell us if you're changing it. Tell us if you have any other questions. Okay. Well, thank you for your attention, and I'll take any questions or Q&As.
Hi, Dr. Huang. It's Julie. Jack is on. Okay, go ahead, Jack.
Yeah, I was just going to say thank you so much for all the great information. There was a question that came in about whether or not there are versions of pseudoephedrine that are made for people with high blood pressure, and if so, what are they called, and are they over the counter or are they prescription?
Sudafed are over the counter. It's another name is called phenylephrine. So Sudafed is a Dayquil, NyQuil. Those usually have a Sudafed, and they're sometimes Robitussin, like strong DMs. Those can have phenylephrine as well. So make sure that you read the ingredient, what's in there. They usually have multiple medications already in one bottle. So pay attention what you're taking. If you're taking Sudafed, you're not taking another decongestants on top of it. That will increase your blood pressure even further. So I recommend pay attention when you take a medication that already has multiple ingredients in it.
Great, thank you. There's another really specific question here about long-term effects. There's a couple of medications listed here: amlodipine, losartan, atenolol.
Yeah.
What are the long-term effects of those?
So it's a person taking all three at the same time?
It doesn't say. I think it's just sort of a general curiosity of whether these are a type of medication you can take along.
Those are all the different type of blood pressure medications. Amlodipine is a very well, a lot of people on amlodipine. It's a medication. I mean, all those pharma medications has a side effects. So some people taking who has amlodipine has most common side effects they experience is this leg swelling. So if you have any swelling legs after starting amlodipine or even after a long time, I recommend you talk to your healthcare provider. And there's many other classes that you can take. Long-term effect of those medications are very, it's not, it's the side effects that you experience right away. It's a lisinopril. Is that lisinopril that you mentioned or losartan?
Losartan.
Oh, losartan. Losartan is a great medication. It's a great blood pressure medication. It helps your heart. There's a lot of big randomized control study. It's good for your heart health. It's good for your kidney health. If you have diabetes, high blood pressure, that's the best medication to take. Obviously, no medication is better, but if your blood pressure cannot be controlled with just the lifestyle modifications, that's the number one medication that I prescribe to patients. So long-term effect, it's control your blood pressure and then make you, it's healthier. There is not much long-term side effects per se from losartan. Atenolol is a beta blocker, so it can lower your heart rate, and especially when you take other beta blockers, or sometimes atenolol, if someone who has asthma, it can have a little bit of asthma exacerbation. So you have to take it with caution if you have those other medical conditions, but atenolol can lower your heart rate. So you might feel a little dizzy and lightheaded. Those are the common side effects that I can think of.
Great. It looks like we have a couple of raised hands for people that have questions. So Julia, I'll have you open mics if need be for that.
Will do. We have John Halligan. If you want to, I'm unmuting you. Is that working? Let's see.
I think there are some Q&A.
Yeah, there is. Why don't you go to that and we'll see why my wait, John's on. Let's do that first and then we'll go back.
Hi, John.
Hello, doctor. Yeah, first of all, you look too young to be a doctor. Are you sure you?
Okay. I take that as a compliment. It's a camera. We got a new computer.
It's called
we got a new computer, and then they give me like this, I don't know, like filter. I don't know.
It's called Blarney anyway. But I read in a newspaper column, and then I checked with my cardiologist. I have a pacemaker and 3 stents.
Okay.
And by the way, they tried to put in another stent, and he couldn't get to it. He said it's too narrow and too hard.
Okay.
So he put me on medicine, and I've been on that for the last year, and that's working fine instead of a stent. But this columnist said older people, high blood pressure up a little higher is okay in older people. It actually prevents some kind of dementia. And my heart doctor agreed. I take about 3 different medicines, and my blood pressure is around 150 in the morning over normal, all that. And it brings it down to 120 and below that.
Right.
And he's not concerned with that. He says that's fine for an older person, especially. You don't want to get dementia. So that's
right. So there's, it's medicine is always evolving. So there is a big trial a few years ago. It's called the SPRINT trial. I think that's what he was referring to. There's a about any patient who's over 65, whether the blood pressure limit has to be changed. There's a lot of controversy about this. So I think it's really individualized. If you have even though its guideline is there for just a guideline, not everyone it fits on the guideline. So if you have any history of falls, if you have any history of dizziness, lightheadedness, if you have unstable legs, imbalance problems, or like ringing, like Meniere's disease, or other conditions that might give you high risk of fall, I do not tightly control the blood pressure. So your blood pressure might be in the morning 150. Blood pressure tends to be a little high in the morning. It's a physiological response. Our cortisol level goes up high. So if your blood pressure is persistently that, and then we just have to monitor we have to monitor your kidney function, your heart function. If those are stable, then we go individual. It's nothing is like not everyone is fit in that category, but it's in the general population. So it really, all the medicine, medication and everything adjustment has to be individualized. So if your blood pressure 150 and you feel great and your cardiac function is great, your kidney function is great, and I think the risk, if we lower your blood pressure too low, then you might have tendency to get lightheaded, from the sitting to standing position and things like that. So, and I think I think it had to be all individualized.
Wonderful, thank you, Doctor. Harry K is raising his hand, so I will unmute him, and then we've got a couple other chats and questions, and we can get to after that.
Okay.
Harry, you should be able to.
Yeah, I think
I unmuted.
Yeah. Yes.
We can hear you. Hi,
Okay.
Harry.
Hi, how are you, doctor? I really enjoyed your presentation.
Oh, thank you.
I'm on blood pressure medication, lisinopril. I'm almost 76 years old, and my doctor has told me that as long as it's less than 140, not to worry about it. When I take it, it tends to be a little higher than that. I used to be on more lisinopril. The dosage was cut down when I lost some weight.
Right.
I lost about 30 pounds and
Good.
was getting dizzy. So
Okay.
Anyway, I'm just curious as to your opinion, because I'm told if it's 140 or less, not to worry about it at all.
So
at my age.
Right. So it depends on what type of medical conditions you have, whether you have your kidney function, like, I'm a kidney doctor, your kidney function is stable, or your heart function, you don't have any heart failure. Someone who has, or diabetes. If you have any other pre-existing conditions, your blood pressure goal might be different than other people. So if you have diabetes or you have high blood pressure on top of it, we recommend you take it less than 130/80. But if you have no other conditions, medical conditions, 140, like I mentioned with John, it really depends. If you feel dizzy, if you feel dizzy for like I said, blood pressure ranges. So you might be your 140, and then maybe afternoon you might be 120, and your body senses that it's not it's too low with the blood pressure, and you might feel dizzy, and that might cause you to fall, which has more a negative impact in your health. So it really depends. So that's why it's very important to have a log of it, what your blood pressure is throughout the day, and then how long it's been, and then that's when we can adjust it if we need to.
Wonderful. Well, I'm going to jump in here just because we're at time and there's a bunch of questions, and so I want to say thank you for all the questions, but we'll wrap up, and I tried to consolidate and get a couple in here. So Dr. Huang, let me just pose a couple of questions that might represent some things we're seeing in the chat. On the no list, we have salt, right? Is there any good version of salt any alternative to salt to make things tasty, or is all salt just to be avoided?
All salts, sorry.
Okay, yeah, that's what I sort of expected. And
There's a tastier salt, but salt is salt, and it will increase your blood pressure.
Okay.
In a moderate amount. I'm not asking you we need salt to survive. Definitely need salt to survive, but too much salt is the main problem in Western world.
Got it. And so how about caffeine? So folks who
caffeine will increase your blood pressure.
So 1 cup of coffee, okay?
It's okay. That's okay. 1 cup of caffeine and some caffeine, it can be beneficial if you have even sometimes kidney stones. Like, we recommended caffeine it's our mood will be different, depends on caffeine. So caffeine will increase your blood pressure, but you just have to, it increase the hormone level in our body, but it really depends. If you have have high blood pressure at that time, do not drink caffeine. But if you drink 1 cup of coffee and then you've been doing that's okay. I'm not asking you to stop it.
Great. And then
it's just moderate amount.
And then we'll just wrap up with sort of the opposite end of the spectrum. Is there an equal level of concern with low blood pressure as there is high?
Yes. Low blood pressure, you need enough blood pressure to pump, for the heart to pump around it. So low blood pressure, is there a measurement when blood pressure too low? Yes, if your blood pressure too low, you might not be drinking enough water. You might not be having a lot of salt food. So those patients, if you have those symptoms, and then it says from the stage 1 to normal without medication. Yeah, so low blood pressure is also an issue too, but a lot of people have, not everyone has the same blood pressure. Your baseline blood pressure, some people might have 90/60, and that's all they have, that's how they have their lifetime, and that's okay. We don't call it as a low blood pressure. It only is a low blood pressure if your blood pressure used to be higher, 140, and all of a sudden drop to 90, then you need to get a medical attention and then figure out what's going on.
Wonderful. Well, Julie, I think we probably are at time, and so I want to be respectful of everyone's time and wrap there. I just wanted to say, if anyone is interested in reaching out to Dr. Huang's office, I have included a link in the chat with information on how to reach her office and the phone number there. So that is in the chat if anyone wishes to grab that.
Yeah, sorry, I see all the questions, and I wish I can answer everything. But well, thank you for all your participation. Just quickly, valsartan take at night is probably better. Blood pressure medication take at night, in my opinion, is better than rather than in the morning.
Well, thank you so much, Doctor.
Yeah.
We really appreciate it. This has been very informative. So this session has been videotaped, and so we will make that link available to you, and you can follow up as well. Look at it again if you missed anything. Thank you all for attending, and have a great day.
Thank you, doctor.
Thank you all.
Thank you, Jack.
Thank you.
Yeah.